Welcome to Steve Means Business, the podcast dedicated to promoting and highlighting small business all across America. As an entrepreneur who has launched many small businesses in various industries over the years and blessed with the gift of gab, Steve was made for this podcast. Let's do this.
Welcome to Steve Means Business, the podcast all about promoting small businesses all across America. Today's episode really hits home with me and probably most of our listeners and viewers, and that's pain. Whether it's through sports or just everyday life, unfortunately, we're all going to deal with pain, muscle aches, body aches, joint aches, tendons, pulled muscles, whatever the case is. We're all going to have to deal with some level of pain throughout our lives. And today, I think I got just the guy that can help us, Dr. Steve Eisenfeld from Valley Integrated Pain. Doc, welcome to the podcast.
Nice to be here.
Tell us all about yourself, your practice, Valley Integrated Pain. The floor is yours.
Well, grew up in Arizona. I've been to grade school here, high school, undergraduate, medical school in Tucson. After that, I did a year internship in general surgery. I switched over to anesthesiology and then completed the anesthesiology residency at UT Southwestern in Dallas. Stayed on for an extra year there and did a 1-year-long fellowship in pain medicine. Returned to the Valley in 1995, where I was doing both anesthesiology as well as pain medicine, and then eventually just transitioned to pain medicine only.
Okay. And for the viewers at home, I like to do these on site wherever I can. So we're actually coming to you from Dr. Eisenfeld's surgical center. Here's this is actually the table where the microphone is, where I've been treated. So it is kind of ironic. It brings back memories, and he's treated me a bunch on a variety of things we'll get into. But anytime I have the opportunity to do it on site from the business owner's facilities, I like to do that. I think it just gives the ambiance. What kind of conditions or situations or injuries specifically do you treat, Doc?
I'm an interventional pain specialist, so what I'm mostly going to be doing is injections. I do some of the more conservative medical management as well. But I'm going to say probably the vast majority of what people see me for is going to be, number one, spine-related stuff. So mostly cervical spine, lumbar spine, so neck and low back. Then it's also going to be joint problems. It's going to be shoulder, hip, knee, but I do a variety of other stuff as well. It can be small joints as well. Hands, fingers, ankles, toes, and then also just musculoskeletal stuff. Myofascial pain, tendon disorders. Probably the most common is going to be rotator cuff stuff.
Right. Unfortunately, I checked the box on almost every one of those where I've been dealing with so many of those. But recently, Dr. Eisenfeld treated me. I had a brutal case of plantar fasciitis. And full disclosure, Dr. Eisenfeld and I, we play pickleball quite a bit together. So we're both dealing with injuries periodically in this app, but we've been on the courts over a year with each other. So we see a lot of each other, in sports settings as well. And the plantar fasciitis, for those that had it, you can relate to how just brutally painful it is. Doc gave me a series of injections about 5-6 months ago, and knock on wood, everything is fantastic. He also treated me up here at my neck. I've had some issues, and he's got a fantastic touch, and I can attest he has treated me successfully, and it's just part of life. If you're active, it's going to happen and what have you. So I can relate to some of those, and I've also had rotator cuff surgeries and torn rotator cuff labrums. So I know how that goes.
But we haven't gotten to that yet.
No, thankfully, right. We haven't, right. That was about 10, 15 years ago. I tore my rotator cuff and labrum and broke my shoulder twice within about a 4-year period. And it was Dr. David Bailey, one of the prominent orthopedic surgeons in our town, treated me and, surgically fixed me. So he's been fantastic as well. So, but I have had the injections over the years. And, what I found is sometimes one doesn't do it. You need multiple injections. And could you speak to that a little bit about how, obviously it depends on every patient's different, but talk to the people about why you would need a series of injections and specifically what you're injecting and where, and talk about that if you can.
Probably the only thing where you could say there's going to really be a series of injections, I'm going to say it's more likely just for knee problems when we're doing joint injections with the gel or hyaluronic acid. Depending on which substance you're using. It could be a single injection. It can be 2, it can be 3, it can be 5 injections. That's the only one that's really going to be, I would say, a series. A lot of people talk about doing a series of epidural steroid injections.
That's what I've had in the past. Even before I met you 10, 15 years ago, I've had many of those.
And that can be either in the neck, the mid back, the low back. But that's actually really not true. You have to have a series. With those, we can do up to 3 injections. With me, what I'm going to do is the first time when you see me, it's going to be an evaluation. We'll look at you. I'll look at your MRIs with you. I'll look at your x-rays with you. If you need an epidural steroid injection, we'll do it here with the fluoroscopy machine under live x-ray. I'm going to do one. Typically takes a few days to kick in. I'm going to see you back in the office. I'll let you determine whether you think you need another one. If you think you're good enough with one, fantastic. That's all you need. But we can do up to 2 more if you need it. When they looked at some of the studies, they said you could have continual improvement up until the 3rd one. So that's why we can do 3, but you don't necessarily have to do 3. I like to see the people in between so I know where you're at. Like I said, if you tell me you're good enough, fantastic. You don't need the other ones.
Right. When you treated me the last time for, I believe, because we had both the foot and the neck, one of the things I liked is, with the ultra, and if I'm I'm probably going to botch some of the technical terminology, so please correct me by all means.
You and me both.
Yeah, right. You had the ultrasound machine involved, and you really pinpoint, no pun intended, the bullseye of exactly where you want to go. Whereas when I had them done in years past, sometimes some of the other doctors it was just like, hey, it's like, just wing it, spray and pray or something like that. But talk about how you do, using the ultrasound and the other technologies and procedures or equipment to really pinpoint the area of concern.
Depending on what procedure it is, really is going to determine what modality I use. As you talked about doing the epidural steroid injections, I do all those under fluoroscopy, so x-ray. Basically, I put my foot on the button, and every time I do, it takes a picture. If I keep it down on the button, it's a live x-ray. That would be for epidurals. I do that also for some of the joint injections. For larger joints, it's going to be hip. I think it works better for shoulder as well on larger people. There's other things we can do with the fluoroscopy. Mm-hmm. And like I said, we'll do those here where we're at right now in the surgery center. Other soft tissue stuff or even joint stuff I can do with ultrasound in the office, as you're talking about with your plantar fascia. Mm-hmm. Great modality. I mean, I get a great picture. I can see, the bone, the calcaneus, where your plantar fascia attaches to. I'm using a small needle, and you weren't seeing the needle since you were facing down. But when you use the ultrasound, it's just absolutely incredible. You actually see the small needle, and you see exactly where it's going to. I'm putting it into a spot where it exactly needs to be. Some of the places like maybe shoulder or knee, I might be putting that into a space that's, an 1/8 or a 16th inch big. And then when I put my injection in there, the fluid goes in there, you see it expand it. You know you're in the right spot. Mm-hmm. If you really want to get better, obviously it's going to work better if the medication goes in the right space.
What other modalities are available for various conditions that you treat?
Well, with me, I'm typically going to start more conservatively. If you haven't had any, if this is an injury that just started like a week ago, mm-hmm. I'm not going to jump on you and start telling you need injections. I'm fine with doing some conservative stuff, oral medications. They could be oral steroids, it could be anti-inflammatories, it could be muscle relaxants. I'm fine with doing other conservative modalities. If you want to do physical therapy, I can set you up with physical therapy. Typically, I know who's in the area that I like to use, so I'll send you close to home. You're not going to come to my physical therapy. I'm going to send you to who's close. Other modalities, I'm fine with massage therapy. I'm fine with acupuncture. I'm fine with going to chiropractic therapy. Mm-hmm. I think they all have a part, and I'm fine doing those before you want to decide that you want to move forward with some stuff that's more interventional.
I think that makes sense. I like the conservative approach as well. Nobody wants to prematurely jump into, whether it's injections or something even more severe or
Surgery.
right, obviously. And it's good to hear that you do partner up. I figured, even before I came to you, it makes sense that you partner up with some of the premier physical therapy practitioners here in the Valley. And we're in Scottsdale, by the way, where I'm going to include all the information for Dr. Eisenfeld's practice. We're here in the Shea corridor of Scottsdale, which anybody that knows that area, it's a hub for medicine. It's right where Honor Health Shea Campus Hospital is. It's walking distance to the hospital. So we're all in this huge medical hub right here. Like I said, I'll list all the respective, information. But here's one question I've always had over the years, even before I met you and started getting treated by you. I've heard that certain body parts react differently and depends on what the injection is, what the medicine is. A knee might respond better than a hip or a shoulder or a back or a neck. Can you speak to some of that?
I mean, I think it's going to really depend on what the condition is. So like I said, with me, I'm going to look at everything. I'm going to look at you. I'm going to look at your x-rays, whether MRIs, anything that you have. And really, I think it responds better when you come up with the correct diagnosis. So something like low back pain. Okay. Is the problem coming from the discs in the low back? Is the problem going to be myofascial, so muscular? Is it going to be, one of the common things is going to be facet joints, the joints in the low back? Is it going to be sacroiliac joints? And how you respond was also going to be, well, what have you tried in the past? Have you had a surgery and you got screws and rods spanning your lumbar spine? Okay. That means the problem might be coming from above or below it. What have you had done before? I mean, if you've had stuff done and done meticulously and accurately in the past, and it worked or it didn't work, I think something like that comes into play as well.
How about when somebody needs to connect the flux capacitor to the Knudsen valve? How does that work?
That's a little bit above my pay grade, so I'll leave that to you.
Right. Obviously, the ultra sarcastic trick question, I can't resist that line. Tell us one of the big things I've heard over the years, and I have not had it done, but I looked at it and considered it when I had some, 10, 15 years ago. I mean, at one point I fractured my neck. I've had brutal degenerative disc issues over the years with both my upper back and lower back, is PRP. And we've heard about PRP so much. That's one of the treatments that I heard is more effective potentially for one body part versus another. Do you offer PRP? And if so, tell us about it.
So I think that's part of the, I guess you'd say, more of an emerging technology of regenerative medicine. Yes, I do it. The things that I'll use are PRP and exosomes. And once again, it's really going to depend on what's going on. I think it's great for joints, it could be for tendons, it could be other places as well. You can put it, I've seen people doing trigger points. It's used cosmetically. It's put in disc spaces. Probably the majority of what I'm using it for is going to be joints. It could be large joints. It can be small joints. It's been put in facet joints in the low back, thoracic spine, cervical spine, knees, ankles, hips, shoulders. I think it's something to consider. It's not covered by insurance, unfortunately. So once again, I'm going to start more conservatively with therapy, medication. Okay, let's put a little steroid in there. If steroid's going to last you for a year or two, fantastic.
Right.
Do that. It's not something you want to have, I don't think, routinely as steroid and often. Steroid's going to be anti-inflammatory. It's going to treat the symptoms. If you're talking about the regenerative stuff, you're looking at something with growth factors that may heal and help to regenerate wherever you put it. Once again, though, how you respond is going to be dependent on what's going on. If you've got hip problems or knee problems that are bone on bone and you have no cartilage left, you're not going to be a good candidate for it.
Yeah.
If you have a rotator cuff problem, we have a completely torn rotator cuff and it's retracted, it's probably not going to help you.
Right.
So I don't recommend for stuff like that.
Something completely torn. I know when I tore my rotator cuff and tore my labrum and broke my shoulder, little injection's not going to help. I mean, that needs to be surgically fixed, repaired, put back together. And like Steve Austin, the $6 million man, although I wish I was like that, but right, I get it. One thing that is the jury still out on PRP, or is it constantly evolving? Or because I've heard opinions from other I know a couple of professional athletes in town that have had it done. They swear by it. Other people said, oh, it didn't garner the results they thought. And maybe people just had overly optimistic, expectations. But is it is it always evolving, or what's the story?
No, I think with PRP, you probably say that's the most researched regenerative therapy.
Mm-hmm.
I think there's a lot of evidence that yes, it can help. But when you start talking about, some people say it works great. Some people say, oh, it didn't do anything for me.
Mm-hmm.
You know what? It's patient selection. Once again, if you come to me and you say, listen, I'm bone on bone in my hip. I got no cartilage left. Everyone's telling me to have surgery. I don't think you're going to be a good candidate for it. If you have areas of cartilage that are damaged, okay, yeah, I think it's worth a try, especially if the next step someone's telling you to have surgery.
Right.
So it's patient selection.
Mm-hmm. No, I can imagine, and right, it's not a one size fits all type of stuff. I mean, right, every person, their condition, where they come to you, their age, their level of fitness, activity levels, maybe their weight, if they're carrying extra weight on their knees or something that, somebody, a lot larger than a small person may have. Everybody heals differently. Everybody, reacts differently, I'd imagine.
Yeah. And now it's also following the rules, because I like people to rest and avoid strenuous activity.
Mm-hmm.
For the knees. Okay. You still got to walk,
right?
But you know what? If you went out and played the next day and stared playing pickleball again,
right.
5 days a week,
right?
I don't think you're really giving your body an adequate amount of time to heal.
Well, nobody,
which is what this sort of is.
Nobody around here does that. Yeah, right. I just played 4.5 hours last night. It's still 108 degrees out in Phoenix, and it beats 112 versus last week. But at pickleball, that's the funny thing, and like I said, Dr. Eisenfeld and I, play pickleball a lot, and it gets really confusing for the other team because we're both named Steve. But
I'm on the injured reserve list.
Right. Steve is right. He's on the DL or the IR right now. But that sport requires so much more athleticism, I think, than people think. I thought in the beginning, this is what's really going on here. But especially if you play singles, the cardio aspect of it and the stop, start.
It's tough on the body.
It is. It absolutely is. After a long session, I've got a whole routine to cool down, wind down. I do the cold plunge.
Well, how many things have we done? I think, did you have tennis elbow?
So I had tennis elbow,
my knee,
right, exactly right.
Hip,
the foot, the foot, the heel, the neck, everything. So I'll tell you what, a doctor could camp out in the parking lot of all these pickleball facilities.
Maybe I'll set up a clinic.
It actually would not be a bad business idea. But, as we bring this to a close, what could, I guess, and let me even back up one step, because for some of the people, we throw the word PRP around a lot, of the acronym. Give us the basics of what PRP is. And we should have started with that earlier, but just so people can get a basic idea of what it is.
Basically, a PRP is platelet-rich plasma. It's derived from blood, so your own blood. So for me, you come to the office, I'm going to draw your blood. We put it in a test tube, put it in a centrifuge, separates it into different layers. There's a platelet-rich and a platelet-poor. Depending on the volume I'm using, I'll draw off some of the platelet-poor, the PPP, depending on the size of the joint, because you can't fit 5 cc's of fluid into a finger joint or something like that. So it can be concentrated. It also depends on the size of the test tube, but it's basically your own blood, separates it out into different layers. And then what we're concerned with is the one that has the platelets in it. Then there's also different types of, PRP. There's, leukocyte or white cell rich, white cell poor, depending on whether you're going to put it on a tendon and a joint. Some controversy with that. And then there's also different machines. So, different concentrations. Concentration has varied. I think some of the, now they're recommending typically 3 to 5 times the platelet concentration. While in the past, we used to try to get large volumes and give you, a lot higher concentrations. So I think it's been more successful with the lower ones now.
Okay. And I guess as we bring this plane down for a landing, as they say, just any other things you want to get out there about your practice that I'm assuming we know you do accept insurance, obviously, because a lot of physicians these days are going to the concierge only model where they don't take insurance, which, frankly, negates a lot of people for going to see you. So that's great to hear that you do take.
I do take insurance, except for, like I said, the regenerative stuff is not covered by the insurance, but other stuff like, the hyaluronic acid for knee osteoarthritis of the knee, that is covered by insurance if you take the insurance. So,
Okay.
It's also a matter of picking the right medications and then putting the medications in the right spot.
Okay. Well, no, I appreciate it. And like I said, Dr. Eisenfeld is right here in the Shade Corridor in Scottsdale. I'll include a whole bunch of information here at the end. I want to thank you for joining us on the podcast today. That was really helpful. It's informative. And I know this is going to be helpful for a lot of people out there, whether you're listening or watching on any of the platforms that we're on. We're on Spotify, YouTube, Facebook, Instagram. So hopefully they'll get a good visual. They benefited from some of this information. And like I said, he's got a fantastic touch, seriously, with the needles. So if you have any pain issues, definitely check out Dr. Steve Eisenfeld from Valley Integrated Pain here in Scottsdale. And we'll see you on the next episode. Take care.
Also, if you got any questions, you know what? You don't have to come in for a visit. Feel free to call the office, talk to Vicki, ask her questions. Happy to answer some questions before you even see me.
That's a great.
How to even be able to help.
That's a great thing, and I shouldn't even add that. I did see Vicki, and that is something that's nice to see. At a lot of these doctors' offices, it's a new face every week, and you've had Vicki there for a long time, and so that's reassuring. That's getting back to old traditional roots, which is not a bad thing. But I'll include all your contact info so everybody can get in touch with you, and that's a great service as well. So people don't have to physically come in here; you can communicate on mail.
Plus, curbside consults at the pickleball courts.
That's right. That's exactly. Yeah. Be careful what you say, because they may take your time forever. We'll never get a game in. Right. Okay. Like I said, we'll see you guys on the next episode. Take care.
Thanks.
That's going to do it for today's episode of Steve Means Business. Be sure to subscribe and share this podcast with all your friends. Keep a heads up for episodes every week.